is 2019 novel coronavirus or 2019 Ncov acute respiratory disease? And what are the symptoms and prevention? Hi, this is Health Vine TV, reporting updates on the outbreak of 2019 novel coronavirus. If you're new to the channel, don't forget to like and subscribe to learn more about health and wellness. 2019 novel coronavirus, also known as 2019 Ncov acute respiratory disease, is a virus, more specifically, a coronavirus, identified as the cause of an outbreak of respiratory illness first detected in Wuhan, Hubei province, in China. Early on, many of the patients in the outbreak in Wuhan, China reportedly had some link to a large seafood and animal market, suggesting animal-to-person spread. However, a growing number of patients reportedly have not had exposure to animal markets, indicating person-to-person spread is occurring. Rarely, animal coronaviruses can infect people and then spread between people, such as Middle East Respiratory Syndrome or MERS and Severe Acute Respiratory Syndrome or SARS. At this time, it's unclear how easily or sustainably this virus is spreading between people. Infections with 2019 Ncov, most of them associated with travel from Wuhan, also are being reported in a growing number of international locations. Chinese health authorities were the first to post the full genome of the 2019 Ncov in GenBank, the NIH Genetic Sequence Database, and in the Global Initiative on Sharing All Influenza Data (GISAID) portal, an action which has facilitated detection of this virus. 2019 Ncov is a beta coronavirus, like MERS and SARS, all of which have their origins in bats. Outbreaks of novel virus infections among people are always of public health concern. The risk from these outbreaks depends on the characteristics of the virus, including whether and how well it spreads between people, the severity of resulting illness, and the medical or other measures available to control the impact of the virus. This is a serious public health threat. The fact that this virus has caused severe illness and sustained person-to-person spread in China is concerning. The risk to individuals is dependent on exposure. At this time, some people will have an increased risk of infection, for example healthcare workers caring for 2019 Ncov patients and other close contacts. For the general public, who are unlikely to be exposed to this virus, the immediate health risk from 2019 Ncov is considered low. Here are the locations with confirmed 2019 Ncov cases: China, Hong Kong, Macau, Taiwan, Australia, Cambodia, Canada, Finland, France, Germany, India, Japan, Malaysia, Nepal, Philippines, Sri Lanka, Singapore, Thailand, the Republic of Korea, United Arab Emirates, United States, and Vietnam. For confirmed 2019 Ncov infections, reported illnesses have ranged from people being mildly sick to people being severely ill and dying. Symptoms can include fever, cough, and shortness of breath. How 2019 Ncov spreads. It is thought to have happened mainly via respiratory droplets produced when an infected person coughs or sneezes, similar to how influenza and other respiratory pathogens spread. Spread of SARS and MERS between people has generally occurred between close contacts. How 2019 Ncov prevented. There is currently no vaccine to prevent 2019 Ncov infection. The best way to prevent infection is to avoid being exposed to this virus. Medical specialist always recommends everyday preventive actions to help prevent the spread of respiratory viruses, such as 1. Stay calm and don't panic. People are likely going to panic because of misinformation. 2. It's currently flu and respiratory disease season and medical specialist recommends getting vaccinated, taking everyday preventive actions to stop the spread of germs, and taking flu antivirals if prescribed. 3. Eat healthy foods to boost the immune system and helps your body fights these diseases. Check our videos, we have suggested foods to stay healthy. 4. Wash your hands often with soap and water for at least 20 seconds. Use an alcohol-based hand sanitizer that contains at least 60% alcohol if soap and water are not available. 5. Avoid touching your eyes, nose, and mouth with unwashed hands. 6. Avoid close contact with people who are sick. 7. Stay home when you are sick. 8. Cover your cough or sneeze with a tissue, then throw the tissue in the trash. 9. Use face mask in crowded places. 10. Clean and disinfect frequently touched objects and surfaces. Treatment of 2019 Ncov. There is no specific antiviral treatment recommended for 2019 Ncov infection. People infected with 2019 Ncov should receive supportive care to help relieve symptoms. For severe cases, treatment should include care to support vital organ functions. People who think they may have been exposed to 2019 Ncov should contact your healthcare provider immediately. Here are steps to help prevent the spread of 2019 Ncov if you are sick. If you are sick with 2019 Ncov, follow these steps to help prevent 2019 Ncov from spreading to people in your home and community. 1. Stay home except to get medical care. You should not leave your home except to get medical care. Do not go to work, school, or public areas, and do not use public transportation or taxis. 2. Separate yourself from other people in your home. As much as possible, you should stay in a different room from other people in your home. Also, you should use a separate bathroom, if available. 3. Call ahead before visiting your doctor. Before your medical appointment, call the healthcare provider and tell them that you have, or are being evaluated for, 2019 Ncov infection. This will help the healthcare provider's office take steps to keep other people from getting infected. 4. Wear a face mask. You should wear a face mask when you are in the same room with other people and when you visit a healthcare provider. If you cannot wear a face mask, the people who live with you should wear one while they are in the same room with you. 5. Cover your coughs and sneezes. Cover your mouth and nose with a tissue when you cough or sneeze, or you can cough or sneeze into your sleeve. Throw used tissues in a lined trash can, and immediately wash your hands with soap and water for at least 20 seconds. 6. Wash your hands. Wash your hands often and thoroughly with soap and water for at least 20 seconds. You can use an alcohol-based hand sanitizer if soap and water are not available. Avoid touching your eyes, nose, and mouth with unwashed hands. 7. Avoid sharing household items. You should not share dishes, drinking glasses, cups, eating utensils, towels, bedding, or other items with other people in your home. After using these items, you should wash them thoroughly with soap and water. 8. Monitor your symptoms. Get medical care quickly if your illness is getting worse, for example if you are having trouble breathing. Call the healthcare provider ahead of time and tell them that you have, or are being evaluated for, 2019 Ncov infection. This will help the healthcare provider's office take steps to keep other people from getting infected. 9. Avoid contact with pets and other animals. Do not handle pets or other animals while sick. Although there have not been reports of pets or other animals becoming sick with 2019 Ncov, several types of coronaviruses can cause illness in animals and spread between animals and people. Until we know more, avoid contact with animals and wear a face mask if you must be around animals or care for a pet. Thank you for watching the video, give it a thumbs up and share it with your family and friends.